Dear members, dear participants of the international exhibition Digital Health, which is organized the third time, and we are so glad to see you in such a comfortable atmosphere, interactive way of communication, and with a great pleasure, I'd like to introduce our speaker, Karin Kallander, Senior Health Specialist and Digital Health Lead of UNICEF. Hello.
Hello,
Karin.
thank you for having me.
And we have the title of presentation, The Use of New Technologies and Innovations in Healthcare Triggered by the Pandemic. So if you are ready, you are welcome.
Thank you. And let me share my screen.
Yeah.
So I have prepared a few slides. So I'm going to talk about some of the new technologies and innovations that we have introduced at UNICEF in the countries where we support national governments in their response to COVID-19. And maybe just to start, I wanted to go back and talk a little bit about what UNICEF's health response to COVID has looked like. And it has primarily three objectives. The first one is around ensuring that we have guidance, national guidance available on the healthcare needs of mothers, newborns, and children that can help health workers and governments to provide the most appropriate care and case management and referral. And this includes, for example, preparing guidance notes on community-based healthcare in the context of the COVID pandemic. The second objective is for us to ensure that we help health authorities to reduce the transmission of the virus, to minimize COVID-19 morbidity and mortality, especially among mothers, newborns, and children in vulnerable groups. And the third objective, which is very important, is to be able to monitor and support the mitigation of what we call the secondary effects of the epidemic response. The epidemic effects meaning, the secondary effects meaning the impact that lockdown has had on routine service delivery, for example. And we know that from past epidemics like Ebola, a lot of children died as a response of the control of the epidemic, like from malaria and other diseases, because they couldn't access care. And for COVID, we know that modelers say that up to 1 million additional child deaths can occur as a result of disruption of services as a result of epidemic response. So therefore, to be able to monitor this situation, we are looking very much at having data available and real-time monitoring to be able to ensure that this continuation of life-saving services are available. Now, very early on in March, when the pandemic hit, we identify a number of use cases where we saw that digital solutions could really not only augment the response to the pandemic, but in fact, would be the only possible mechanism to deliver certain interventions, given that many countries were in lockdown and there was no other way to reach health workers and patients and population out there was through digital channels. And some of these areas that we identified as priorities included, for example, risk communication and community engagement to combat rumors, but also to spread accurate information to the general population. A second area was to make sure that health workers were trained and that they had enough information about how to protect themselves, how to practice infection prevention and control, and how to handle COVID cases, and using e-learning and digital platforms to channel these new updated training modules. And as I mentioned, we also had to put in place monitoring systems for collecting the data, especially on the routine services that could potentially be disrupted, like immunization and maternal healthcare services. But we also wanted to make sure that health workers were keeping sane and had high mental health during this pandemic. So having help desks for health workers and mental health support was another area we prioritized. Similarly, there were also a number of areas where countries needed help to do contact tracing, surveillance of cases, as well as transmitting test results, for example, from laboratories to health workers. And finally, we have prioritized looking at systems to report stockouts of essential commodities such as sterile gloves, masks, and respirators, and having systems that can accurately track those items. And all this data ideally need to be available to the policymakers using dashboards and visualization techniques that can be used to decide on the right actions. So then, once the health use cases had been identified, we supported the countries in selecting the most appropriate digital solutions, building on platforms and systems that already existed in the countries, knowing that right during a pandemic, it's not the right place to start inventing new solutions or trying to deploy brand new technologies, because there is no space or time or human capacity to do so. This figure, I think, it's a nice overview of all the different digital technologies that could potentially be applied for COVID. It's a figure in a paper by Budd et al. That was published in Nature Medicine earlier this year. And I'm going to highlight a few of the bubbles here on how UNICEF used these digital technologies to address some of the health use cases that were identified, giving some country examples. And I'm going to start with contact tracing. And I'm going to give a specific example from Burkina Faso, which is a country in Africa, in West Africa, which is characterized by deteriorating security and practically a country being in a humanitarian crisis. They were also one of the countries in that region that were most hardly hit by COVID. And by August 2020, the country had registered over 1,000 cases and up to 54 deaths, which is maybe low compared to some other countries, but for this region in Africa, it was still considered high. And obviously very much underreported considering the testing and lab capacity that they have. So as part of its response to the pandemic and the imposed movement restrictions in the country, UNICEF Country Office worked with the Ministry of Health and Ministry of ICT to innovate and deploy quite a unique component to the existing National Digital Health Initiative to support the epidemic surveillance needs. And this is built around a platform called Rapid Pro, which is a UNICEF incubated platform that allows for two-way communication flows, and that can create sort of message workflows that can go two ways, both to the user and then back to the system and into a national database. So it can either be messages or it can be data that can go both ways. So on the front end, there were two apps built. One was a chatbot, which was a conversational agent that users could use to tap in information and seek information or even report symptoms using SMS. The other was a simple smartphone application, which was used by community health workers and health workers with knowledge on COVID to collect data on suspected cases and submit that to a database, which then indicated which response actions were most appropriate. So it's now used by at least one health workers in all 409 health facilities in 6 regions across Burkina Faso. And up to July 2020, over almost 19,000 people had been identified as potential suspected cases through this system, followed by over 500 alerts back to the users that they had been potentially exposed. Mm-hmm. And now UNICEF continues to lobby and advocate to partners in the government to invest more resources to have a national scale up of this solution, which is really a low cost solution in terms of technology, but has been shown to really support an accelerated action to flatten the curve in Burkina Faso. The next bubble I want to talk about, where we have a lot of experience, is around these chatbots that I briefly mentioned. And chatbots can be, if they are designed and deployed in an appropriate way, can really help sharing up-to-date information quickly to a very large number of people. And in UNICEF, we have a platform called UReport, which has primarily been used to communicate with adolescents in a safe space about anything that adolescents are concerned about. However, very early on in February, already on February 13, UNICEF developed a coronavirus information chatbot that was using the U-Report platform, which with all the registered users that already had access to this, to submit information on the coronavirus and have users ask questions through this platform. And this U-Report can run on SMS, on WhatsApp, on Viber, Facebook Messenger, you name it. So we were able to scale from 150,000 users on February 13 to over 2 million users in 3 weeks' time. Now this COVID information platform is accessible and used by over 7 million users in over 60 countries. And we use it to basically provide locally contextual information about the virus and sort of specific information that users are seeking information on. And we're also using it to combat rumors and misinformation. Then shortly after that, in countries who don't have the U-Report platform, our team in Eastern Europe and Central Asia, they worked with WHO to develop what we call a health buddy, which is also a chatbot that is powered by artificial intelligence. So it's learning and becoming better as the more users who use it. And this chatbot is now available in a number of different languages across the European and Central Asian region. And can also track rumors and fake statements and also report, provide the most important information that users are seeking. And almost at the same time, WHO also developed something called WHO Health Alert, which is very similar to the others. It works mainly on WhatsApp and has also gained a lot of traction in a number of countries to provide information on the coronavirus. And these three applications, really, chatbots hadn't really been used so much for general health and specifically for a specific disease. This is a new use case we see that has really made a big difference to a lot of people to be able to access up-to-date and accurate information in an efficient way using tools that they already have in their phones. Now I'm going to move to slightly different, which is mobility pattern analysis using big data. And I'm going to speak about an example specifically in Indonesia. So starting in UNICEF, we have a team called Magic Box who are working, it's a big data initiative and has a team of data scientists that work with partners to provide data, tools and insights that allow for epidemic modeling and forecasting. And they use their data scientist and their platform, the Magic Box platform, to look at the monitoring of physical distancing and the evidence on sustainability and suitability of mobility restrictions for low-income settings, the lockdown, for example, and use this to provide better models that allow a better understanding of the balancing between potential impact of these measures on the disease as well as the underlying communities. So together with the Indonesia country office, the UNICEF country office in Indonesia, the government of Indonesia, and the University of Indonesia, our Magic Box team provided support to access big data, big anonymized data on mobility in the country. And this data came from a company called Cubic, as well as from Facebook, which we have a collaboration with. And because there are so many users, over 140 million users of Facebook in Indonesia, they could generate over 30 million observations each day on their location, all anonymized. So we only know where the trends are in terms of people's locations and where they are moving to. So this data gave us a lot of information on mobility during the lockdown. And we then developed a real-time data dashboard, which had resolution down to the village level. So we could look at mobility all the way down to the village. And we map this along with the stay-at-home metrics, which we could then visualize alongside the movement flow. And what we found is that there's a very strong, significant relationship between mobility, which is estimated by the population who stay at home, and the COVID-19 transmission. So if you see this graph, the you have the blue is the proportion of the population who are staying put, who are not moving anywhere. And the red is the curve of COVID cases. So you saw that in April, when the lockdown happened, we saw an immediate increase to almost 60% of people not moving anywhere. But then as people get tired and they start moving about, the cases spiked. And it's a very clear result, correlation between these two curves. So what we use this data for, especially in countries like Indonesia, is to use this mobility data to track where we perceive the transmission to take place based on people's movements, and to guide policy decisions around school openings and other sort of openings of the society that is influenced by population movement. Mm-hmm. Then lastly, I'm going to move over to these three bubbles, which are around use of data to visualize data, to have dashboards, and using interactive geospatial maps. And this, as I mentioned, has been a priority for us because we really need to understand better how COVID-19 is impacting on health in general of the population, to be able to understand where we have an immediate need to catch up with some services like measles immunizations, for example, knowing that immunization campaigns largely stopped to a halt when the pandemic hit in many countries. So understanding now where we have children who are not immunized and where we have measles cases, for example, is really going to help governments to do targeted outreach and catch up with campaigns. So I'm going to give an example from Bangladesh, where we now repurposed dashboards for COVID specifically using geospatial mapping. And on this picture, you will see this is a dashboard that UNICEF helped develop for the government of Bangladesh, by the way. So you can see here the pandemic across areas of intervention. So it shows here health, nutrition, risk communication, education, and child protection, etc. So it looks at the response across any sector that is regarding children. And for example, it shows here maps of the country and the different regions and how many cases they have. I know the text is very small, but this data is from yesterday, so it's really, really up to date. If I looked at the dashboard today, I would see today's date. So as I mentioned earlier, it's the number of children who will die of the consequences of lockdown and lack of access to healthcare may even be larger than the total number of people dying from COVID in the general population. So we are supporting the governments on really trying to track this and this essential services as much as we can in real time. And in Bangladesh, you'll see on the next slide, if we look at, this is the COVID-19 impact on children's consultations, basically the number of children who went to a health provider over the last 3 years. This is an average that spans over the last 3 years. 2020, in March, you see this, the number of cases in the whole population dropped to 28% of what we usually saw the other years. So obviously, there's a lot of children who would normally be seen by health services who are not being seen. And while services are slowly opening, here in August, about a month ago, we still only see 50% of the children who would go to a facility are now going. So these types of dashboards really give us a good overview of the situation in countries to be able to estimate where there is a need to really restart services. So I'll end there, and happy to take any questions that you might have. Yeah. Thank you.
Thank you for your presentation. My question again, you said about Bangladesh, Indonesia, some examples, and maybe we can say something about Kazakhstan. No?
Yes.
If you have.
Okay. No, I think I can give an example I can definitely give examples from Kazakhstan. I have two good examples I can give.
Also on presentation or just?
Yeah, I can just talk about them.
Yeah.
So if you just ask it as a question, I can talk about it.
Okay. So about Kazakhstan, your answer?
So in Kazakhstan, we specifically have some interesting cases of using mobile technology for early childhood development and using, again, different communication channels to deliver messaging to parents about raising awareness on knowledge and skills of how to bring up a child. So these parenting apps have been proven to work really well in other countries, and now we have a version of this being is about to be introduced in Kazakhstan to be available to any parent who has a smartphone can download this and take part of this two-way communication. Again, communicating with a robot, basically, with a bot, as we call it, but to be able to seek information on child raising. Another area which both Kazakhstan, but many other countries in the region, Tajikistan, but also in Africa, has really picked up on during the pandemic is to deliver health worker training using digital platforms. Knowing that during lockdown and during restricted movements, it's very, very difficult to put health workers in a classroom. It's too risky, and it's been just simply too logistically challenging. And at UNICEF, we're also working on developing content and modules for COVID training that can be delivered on various digital channels. And depending on what system the country has, if a country is a little bit more advanced, they can deliver these trainings on apps, on Zoom, on many different channels. But it can also be delivered as on simple platforms like SMS. And this is something we're working on to be able to make sure that all content can be available on whatever platform the users already have at hand.
Yeah. Karin, and one more question for you. As UNICEF, what do you see is the main role of digital health in transforming healthcare?
So I would say there are three areas where I see what we've learned during the pandemic, where digital health can really come in and support. And one is around strengthening the ability of frontline health workers to deliver world-class care in a situation which are really hampered by the pandemic. So making sure that health workers have access to the latest information, access to training, and helplines to call and ask for help. These things are almost, without digital platforms, during a public health emergency, it's going to be incredibly difficult to deliver updated information to frontline health workers. And a second area I would say is connecting and motivating people, because it's really the people and their behavior that drives the pandemic. And being able to connect with them in a place where they feel that they can get trusted information and feel motivated to take action is another area. And thirdly, I would say empowering governments with real-time data to be able to take a more informed decision and have access to more precise and timely information to plan actions. I think those are the three main areas I would say are the key for digital health.
Yeah. And looking back at the COVID-19 digital health response, what have we learned about how to ensure that national health systems can be resilient and responsive to future health emergencies?
One thing we've really learned during this pandemic is that we were so unprepared for an epidemic like this or a pandemic like this. And
even you in New York, in America?
Even us. Everyone was taken completely by surprise. We thought we had the systems we needed. We knew that there were a lot of countries who didn't have even basic infrastructure. But what we have specifically learned from the response we have seen is that there is no one-size-fits-all solution. There has been numerous databases put in place to list all the different digital solutions that can be used for a COVID-19 response. But unless countries already have some of these solutions in place and can adapt them and adopt them for COVID, it's very, very difficult to introduce new solutions. And those countries who had platforms in place were lucky, because even if it was just a two-way SMS system, that could be quickly adopted for COVID to reach out to people on information and to collect data. But if no such system was in place, it took months to set that up. Another area is, I would say, what we've learned is to really focus on working with the existing health workers and the existing digital infrastructure. It's related to the point I made before, that it's really important to learn how we can adapt tools, even if they're developed for a much more high-tech system, to be able to simplify them and make sure we deliver them on the local platforms, the context that countries are at. And I think also the last one is that single standalone technology solutions will fail unless they are integrated into the broader health system. There were many digital solutions developed, and very much out of goodwill. There were a ton of companies who developed really good digital health solutions for COVID response, but they weren't incorporated or built in a way that could be incorporated in the wider health system, and they will not be able to be sustained. And therefore, it's incredibly important to work with the government in looking at tools that can be part of the national digital health system.
So when looking into the future, what do you see as the next priorities when it comes to supporting national governments in recovering from COVID?
I think we need to learn from this pandemic that we have to make sure that national health systems are more resilient and more responsive in the future, because we know public health emergencies will continue to happen. If it's not a pandemic, it will be an earthquake or a cyclone. And we know that we should have known this. We should have known that there are some basic infrastructure that is required in every country, like, for example, having a national database on all their health workers. It was very, in a way, almost shocking to see how few countries have a complete list of, for example, their whole frontline health workforce with contact information, phone numbers, with their location and with their training skills. So unless you have that kind of database set up, it's going to be very difficult to connect them with information, with training, with data collection tools to understand if the facility they work in is able to see patients and deliver services. So that's one area looking forward. I think the world hopefully will invest in supporting these systems, HR systems, to be set up. Another area is also looking now, we know that in a few months' time, hopefully, there will be a vaccine on the market. And we have an opportunity now to prepare countries for this vaccine introduction. We know it's going to be an incredible effort needed to distribute this vaccine to all the health workers, to all the people over 65 years old and everyone with a risk factor. And unless we start now to build and prepare the systems for this vaccine introduction, we're going to be taken by the same surprise once the vaccine hits the market. So again, looking at what systems are already on the ground, how can they be adopted for the vaccine and supply chain and for monitoring, population estimation, understanding who needs to be vaccinated. Again, we know that this is going to be needed, so let's start prepare for that now.
So, and now, how is the life in America? do you have quarantine, or so wearing mask as usual? Yes.
Always wearing masks when we're outside in every situation, even in the parks. Life is coming back slowly. March and April were difficult times. Now it's October, and yesterday they opened up restaurants, but only very low capacity. Restaurants have been opened for outdoor seating, but yesterday you're allowed to go inside for the very first time since March, which I think gives people a bit of hope. Schools are still closed, mainly working from home education, but hopefully we'll see those services also opening shortly. And this big second wave still hasn't hit us in New York, luckily.
So we just thank you for your time, for your interview. Thank you so much.
Thank you so much.
Be healthy, the main wish nowadays.
Definitely.
So bye-bye.
Bye-bye. Thank you.
Our speaker was Senior Health Specialist and Digital Health Lead at UNICEF, Karin Kallander. And we see you on the next session. See you. Bye-bye.